I got the consumption, don't you know?
Divided by 206 is approximately 0.2524. $52 is 25.24% of 206.
advice from some asshole on the radio. Number one thing, don't take advice from some asshole on the radio.
I love to masturbate.
Yep. Hello. How are you? Good. Huh? Of course. Well, you're a regular. What? No. All right. Test mics, everybody. Echo, count to 12.
Okay, here's number counter. 1, 2, 3,
Echo,
4.
stop.
I'm testing.
Hello?
I don't hear you, Tacey.
Test 2, 3, 4.
You're
Yes.
good.
Hello?
Thank you.
Oh.
Do we have a special topic today or anything?
Nah.
Cool.
Lots of questions.
Oh, that's good.
Yep.
Get my trusty thumbs.
Did you bring
ready.
anything?
I mean, I can always talk about something, you know?
I do want to talk about this new study, this Italian study on COVID and the vaccines and natural immunity and stuff.
Okay.
Cool.
Look, my shirt has thumb
Are
holes,
you going to speak Italian when you do
but
it?
I don't
Yeah,
like
molto
to use them, but I
bene.
like having them.
Ho studiato la
Isn't
lingua
that crazy?
italiano
But it drives
soltanto
me
3
crazy.
mesi.
But I think it's cool.
No este
I like it too.
mucho.
It's
No
like
este
having a
mucho
dress
bueno.
with pockets.
What?
No mucho bueno.
That's not Italian.
That's hillbilly Italian. That's hill Italian.
That's how they
Hillbilly
pronounce
and-
Italian and
Hillbilly.
Yep, they're all yelling, P.A. Lydia.
Oh, really?
She is here.
Hey.
She is here. Thank goodness.
All right. You guys ready?
Yeah, just let me get
Ready?
my wrench on. There we go. Hey guys, what's up? There's Gina. What's up, Gina? Love it, Sean.
Ugh. Some of that.
What up? Kush is easy. Kush is early.
All right.
Yo. Yeah, I'm in. Hope I don't blind anybody with my fancy shirt.
It's a
today.
great shirt. I like it.
Is
Did
it
you just tap
soft?
your gun?
Sport my colors. Do it now.
I was wondering if it was soft.
Oh yeah.
Okay.
Sirius XM. It's time for Weird Medicine with Dr. Steve.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease.
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio and the longest running show on this channel. I'm Dr. Steve. My little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred. The whack alternative medicine asshats. Hello, Dr. Scott.
Howdy, Dr. Steve.
Also have in the studio Tacey, my partner in all things.
Hello,
Tacey.
everyone.
And back from sabbatical, ladies and gentlemen, it's P.A. Lydia. Hello.
Hey.
Hello, P.A. Lydia.
Hi.
This is a show for people who had never listened to a medical show on the radio. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347.
Poohhead.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. I can't mention contractually. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Hey, Dr. Scott, simplyherbals.net, still going. Check him out at simplyherbals.net. That's simplyherbals.net. What's going on there?
Selling that nasal spray like crazy.
Okay, very good. Very good. And you have a super secret project that you can't talk about yet. Is that correct?
It is super secret, and I can't talk about it yet, but we're working on it.
Okay, all right.
Wait,
Stay tuned.
Well, part of the problem is Denver's getting snowed in, and that's where part of the secret project is coming
Ooh, is
from.
it Denver?
Yes. I'm going to give you 3 guesses.
What else do they sell
What?
in
Yes,
Denver?
I can't
Let me
imagine what else
think.
they sell.
Oh
Very good.
my God.
It's top secret, Dr. Steve.
All right, very good. That's awesome. Check out drsteve.com, and we'll try to, and simplyherbals.net. We'll try to keep you up to date on that. I completely revamped the website, and I did it by myself, and now it looks like shit. So I'm working on it. Give me a little bit of time where I can actually spend some time on it. And let's see here. Yeah, all right.
Should we explain why we missed a week?
Well, it was New Year's.
Oh,
Yeah, we can talk about it.
we
I mean, that's why we didn't have a show on.
Yeah, it was going to be a first ever Christmas Eve show.
Christmas Eve.
Oh yes,
Yes,
okay,
yes,
I know.
yes.
Okay, so
we were all excited, and
Yeah,
somebody
it's-
decided to get the puke bug or something.
yeah. So first, Liam's girlfriend had it, and then we thought we were out of the woods, and then Liam got it. So the incubation time on this virus was about 3 or 4 days. That was what screwed it up, and then Tacey got it. And then Christmas Eve, we were going to start, and Beck and I said, if we don't get it by Christmas Eve, we're in the clear. And Christmas Eve, 4 a.m, Beck started barfing. And what a good kid too! Didn't even wake me up. I just, I heard him up at like 7:30 in the morning because I was getting ready to do some stuff, cooking and all that kind of crap. I said, "What are you doing up?" He said, "Well, I've been throwing up since 4." I was like, "Damn, dude, why didn't you?" I mean, in the past, if they threw up or if they had a bad dream, they would wake us up, and he just, soldiered through on his own. Didn't want any medicine. Finally took some Phenergan that made him sleep all day, and he, anyway. So
good.
we didn't want anybody else. Because then the clock starts ticking for me again, because I was out of the woods at that point from Tacey's episode. But
Yep.
today was the last day. No, gosh, that's not right. Wednesday or Thursday. Oops. Well, I've been sleeping
Surprise!
on
We're
the
all
couch for
gonna
nothing.
have it.
No, sleeping on the couch for no. My last day was Wednesday, so there's none of that virus in the house now that we know of, unless we got it in the wild. So, yeah, we were going to have a Christmas Eve show, and we
Yep.
had Christmas music that Scott and I were going to ruin.
Yes, we're going to butcher it.
Damn it!
I know.
Oh well.
I
Okay.
practiced for 15 minutes before I came.
Did you?
a whole 15
I
minutes.
practiced like I normally did. So I was just waiting for you to bring the sheet music and then learn it on the air.
Uh-huh.
Okay. Well, anyway, so yes, thank you, Tacey. I had sort of forgotten about that.
yeah.
Anywho, put it out of my mind on purpose.
How long did it last?
You get-
Your-
8 hours
Oh, okay,
max,
good.
max.
Oh, that's
And then you
good.
feel crappy. For,
Oh, heck yeah.
That's not long enough to lose weight or anything.
No,
I lost about a pound. But then the next day, you're like,
Yeah, I can
Wiped
eat.
out, kind of.
yeah, it's totally wiped out.
Yeah, but then after that, you're like, I can eat anything I want to, and then
I've got a pound
Yeah.
to spare.
Gotta make up for it.
That's right.
All right. Well, do you guys have any topics, Lydia? Did you bring anything today? No.
I mean, I've always there is something called Instagram,
Yes.
right? And they have these
I've heard
things
of this
called
thing.
Reels,
Okay.
which I've newly discovered.
I don't know what those are.
They are
'cause
these
I'm
little
old.
short videos.
Oh, it's their
similar to
version
being
of
on
TikTok.
Yeah. And you can see all of these gross and disgusting procedures.
Oh.
And for some reason, they think that I like it, which I kind of do.
Yeah.
So it was something I've never encountered in medicine, and maybe you have, Dr. Steve. The concept of ingrown hairs we know about,
Yes.
right?
Right.
But the concept of these ingrowing hairs that grow for years
Oh,
under
yeah.
the skin.
Well,
and they get up to like 10 to 20 inches long.
oh, wow.
And then people pull them out.
Huh.
You know,
I've
no
not ever heard
infection.
of such a thing except in a pilonidal cyst.
Yeah, these are just places on.
That sounds.
I looked it up. I mean, there's an up-to-date section.
Okay, you looked
right,
it
on
up.
pseudofolliculitis, but you know that's usually we think of it as being a problem when it's associated with infection.
Right.
Anyway, my question is I've never seen it in someone.
I have never either, except in a pilonidal cyst. So let's
Yeah.
talk about those for a second. Because
Yeah.
when I was in medical school, I remember scrubbing into surgery, and they would pimp you constantly, just ask you question, and half the time you didn't know what the hell. And this time I was totally prepared because I realized they were taking all the questions out of the front of the book where they talked about the history of the surgeries that we were doing. So I knew I was scrubbing in to a
Yeah.
cholecystectomy, and I knew that son of a bitch was going to say,
the little blue
Yes.
the little blue book.
yeah, and I knew they were going to
Yeah.
say, when was this surgery first performed, and I could say it, because I was ready for him, and when I answered it correctly, he was like, oh, okay, here we go. So he kept asking more and more questions, and then he got to one I didn't know the answer to. I said, well, I don't know that, but I know this other thing, and so I answered. He said, good technique. Always answer the question that you know the answer to. So rather than the one that I asked you. So I'm going to answer the question that I know the answer to, which is about pilonidal cysts, because I don't know about these damn ingrown things, that are 20 inches long. But pilo being hair, nidus being nest, so it's a nest of hairs. And it's basically ingrown hairs above your ass crack.
Yeah.
And those things can get really long. And when it comes from sitting, slouching, basically, if you're sitting reclining and you're sitting on your sacrum instead of on your ischial tuberosities. So if you feel down, if you guys are sitting, and people who are listening right now, sit up straight, put your hand under your ass, and you will feel a bone right about equal to where your anus is, but over to the side on either side. There's a bone there, and that's what you're sitting on. Do you feel that? Those are the ischial tuberosities. That's what you're supposed to sit
Your
on.
sit
But if you
bones.
feel the above your ass crack to that flat place, you can slouch backward, and you can sit on that. That's your coccyx and your sacrum. And if you sit on that, then what you can do is you can compress the hair follicles and and you end up pushing them under the skin, and the hair will continue to grow, but it grows under the skin. Yes.
Way more often in men than women, because I don't have ass crack hairs like that.
Yeah, I think so. That's a great question, Tace. Let's see.
And a lot more in athletes wearing jock straps, football players, catchers.
Really?
Yeah.
I can see
that makes
The
sense.
sweating and the those jock straps kind of rubbing and kind of forcing those hairs back in.
Interesting.
Yeah.
Tacey, guess what?
Give yourself a bill.
Damn it!
Nice.
Pilonidal
one.
disease occurs predominantly in males at a ratio of 3 or 4 to 1.
Dang it!
Predominantly in OFE, typically in the late teens to early 20s, decreases after age 25, and rarely occurs after age 45. So I can slouch all I want to.
There you go.
Hell with you all.
There you go.
So anyway, yeah, very interesting. And those things will fill up with hairs that are really long. And the problem with the pilonidal cyst is you can, if it gets infected, you can stick a needle in it, and it will always come back. So they just have to be surgically repaired.
Can get quite deep.
Yep.
We don't go digging around in them in the
No.
office.
No.
Take
No.
them
I
to
mean, you can
surgery,
stick
so.
you can stick your finger right in there. It's disgusting. Anyway, all
Gross.
right. Very interesting.
Yeah.
Thank you, PA Lydia.
I actually saw a patient this week, and they have other problems like cancer that we're dealing with. But he said, yeah, my cyst is starting to leak. And I'm like,
Oh.
buddy, we got bigger fish.
Yeah. I see that all the time too. Or people with stage 4 cancer that are,
Having to sit a lot. And
or just
guess.
worried about things
Oh,
that are
yeah.
tangential to what's going on, because that's easier to focus on. I think
probably.
it's overwhelming.
So talk a little bit about
yeah.
those ingrown hairs. Like when they pull them out, what happens?
Oh man. So it's like they what is it called when you dehead? You take the plane off of something.
Yeah.
I can't remember. Anyway, you take the initial layer of skin off and just open it up because it looks like a deep blackhead, and they start pulling it out, and it's just this hair that just comes out. It's
Something even more
so-
disgusting is look up bot fly infestation, where the bot flies will deposit their larvae under the skin, and you see people. You know, now I can't think of the word either, where you decap it.
Oh man, yeah.
Anyway, you take off the top layer, and then you take tweezers, and you just start pulling these giant maggots out
Oh,
from your
gosh.
skin.
Oh, for
It's
God's
so
sakes.
satisfying.
Where does that happen?
Not
Here?
Not around here. Where are bot flies? I don't know where bot flies are. They're not here though. Where are? We'll ask Echo. Echo, where are bot flies found?
According to an Alexa Answers contributor, bot flies are found in Mexico, Central, and South America. In the U.S., cases usually occur in travelers who have visited endemic areas. Flies live near water, thus coastal and forested or jungle
Echo,
areas are
thank
endemic.
you. Thank you very much. Good Lord.
My pleasure. Just doing my job.
Echo.
Oh,
no,
here
geez,
you go.
shut
Thank
up.
you. She's such a good sidekick.
So anyway,
I'm sorry, I was trying to show Tacey a video, and the
of the
sound
bot
keeps
flies?
going on.
So just turn your
I
sound.
thought this album. I thought you were playing some kind of old spaghetti western.
Yeah. All right. You guys ready to do some questions?
Yeah.
Yes.
Okay.
Do it.
All right. Let's do it.
Number one thing, don't take advice from some asshole on the radio.
All right. Well, we have a quiz from Stacy,
Oh,
and this is a good one.
Right.
I think this is a good one. We'll go around the room. We'll see.
Uh-oh.
Okay. And this is Price is
No
Right
Googling.
rules. Yeah. No Googling.
What percentage of the 206 bones that's in the human body, what percentage are in your feet?
So, what percentage of the bones of the human body are in the feet? And we'll give you that there are 206 bones in the human body.
I'll,
All right, Dr. Scott,
10%.
Tacey,
12%.
Damn it.
Lydia.
1%, Bill. I'm just kidding. Actually, the 10% sounds good. I'm gonna go with Tacey. What did you say?
12.
12. Yeah, I'm doing. I'm sorry, we're having to split hairs here.
It's Price
We're
is
going
Right
with
rules.
11.5.
Oh, that's a terrible answer.
Yeah, that's
She's
a-
going
It's
to get
not.
a negative bail.
It's not a terrible answer.
Is that, yeah, that's a negative answer.
Strategically.
There's only one answer, Dr. Steve. There's only one answer.
Yeah.
13.
Right. That's the if you don't know the answer, that would have he's right. It's strategically from
13.
game playing, because remember, Price is Right rule. It does. I'm not explaining Price is Right rules on the show. Okay, but the answer is going to astound you. There
Is
are
it more?
Yeah, that's 25% of the bones
In
of
the
the body.
feet?
Yes. So here's the deal. There's 26 bones in every foot, and there's 2
Okay.
feet. So if we ask Echo, what percentage is 52 of 206?
52 is 25.24%
Isn't that
of
crazy?
206.
Damn, fantastic, Tacey, you win.
I win.
You gave her a
Dang,
bail.
dang.
That's 2 for her. Now we're 2 behind.
I know, I'll tell
Yay,
you what.
Tacey.
That's just what I get for trying to do math in my head. All the
Oh, that's the
metatarsals
worst. That's the
and
worst.
tarsals,
Yeah.
phalanges.
Yeah, I know.
You
Now-
could not have pigeonholed that answer anymore.
I know. Yeah, it had to exactly be 11.5
That's
for
the
her to
only
win.
answer. Oh my God! All right,
That's okay. We can play
that's all right.
poker with PA Lydia.
Yeah, we could. Yeah, I was like, did you bring cash, Lydia? We might have
Or-
some
Not
money
a
later.
debit card.
We got that. That works.
She may be marking herself as a mark, though,
She's
so
setting
that
us
she
up.
would
I think
set
she's
us up.
sandbagging.
Yeah.
I believe
yeah,
she's sandbagging.
All right. Here's another one, and this is just
Can you breathe and swallow at the same time?
Oh, Lord.
so that's a yes or a no question. So we won't really do that as a quiz. Anybody have any discussion on that?
What about when you choke?
Well, Yeah. So
is that breathing and swallowing
I guess
at the same time?
I guess the question is, can you functionally breathe and swallow at the same time?
Yeah, and what is breathing?
I will say
Right?
no.
Is it
Ooh.
what is breathing?
How do you define the word is?
Yeah. Is it the exchange of oxygen?
Yeah,
and,
so breathing is breathing.
Yeah. Well, your epiglottis should close,
Correct.
so you shouldn't be able to take anything into your esophagus at
But
the
that's
same
the
time
whole
you take
point
a
of
breath.
that.
But,
That's
yeah.
right. Breathing ceases during swallowing, and the pause in breathing is due to inhibition of respiration at the neural control centers of the brainstem, not just due to closure of the airway. So it's an evolutionary advantage to our ancestors, the ones that didn't breathe when they swallowed, and the ones that did and were choking all the time and had aspiration pneumonia and stuff, and didn't live long enough to transfer their genetics to the next generation.
Those neural control centers must be close to how we have patients swallow in order to hopefully get them back into sinus rhythm sometimes.
Yes.
You think?
Yeah.
Very close.
Yeah, and that's some of that. Okay, you bring up a cool thing. This thing called the diving reflex. So when whales and other sea-going mammals dive deep, how is it that they can take a deep breath and stay down there forever? Their lungs proportionally aren't that much bigger than ours, but they can stay down there for hours. And part of it is that when they dive, their metabolic systems start to slow down, and their heart beats slower. Their vagus nerve gets stimulated, which slows down, the blood flow from the heart to the rest of the body, and they're allowed to stay down longer. We have that too. All mammals have it. Even land-going mammals have it. This is the craziest thing. And when I was I was an intern back before we had drugs like amiodarone and stuff. We would have to shock people if they went into crazy rhythms a lot of times. And one time I had this guy, he was totally stable. I said, "You want to try something?" And he said, "Sure." And I said, "Let's do a diving reflex." And I can't even imagine doing this today. But we got a bucket of ice water and, something like one of those plastic basins that they wash people with. And we filled it up with water and ice. And then we took the guy's head and we just smashed it in there. Said, "Hold your breath," and put his face in the ice water as long as he could stand it. And when he came back up, he was like, "That was very unpleasant." And then, boom, his heart went back into normal rhythm. That's cool.
Yeah.
So the old diving reflex. So, so all of those things it's amazing. So why do we have that? It made our common ancestor able to live in the water, but did they give us the gene, or did we just have it? And somehow mammals just had that, and so they were, they could adapt to living in the water. I don't know. That's crazy.
Yeah, you just kind of. Yeah.
I guess it's like,
stimulating the vagus nerve.
We had the
cold water
common.
to shock
When
it
did
back
we
in the nerve,
diverge from reptiles? Right, we went through from reptiles.
Well, it was
to
before.
birds.
Yeah, it was before the big disaster. But we were shrews back then. I mean, mammals were when the dinosaurs died. The biggest mammal was about the size of a shrew. So, but there were mammal-like reptilian ancestors that they found. So, you never find that one that's half and half. It's not how evolution works. But anyway, I don't know. It was a long time ago.
Yeah.
Longest time.
If you believe in evolution.
Well,
just kidding.
yeah.
I'm joking.
No, you're right. If you do.
If you do. Yeah.
If you don't, you believe whatever you want to. It's all faith.
We don't judge you.
I put dinosaurs
judge,
at the
but-
nativity scene this Christmas.
Oh, did you?
We my daughter woke up to Christmas and we had a little nativity scene, and there were the wise men and the dinosaurs.
Oh, yeah.
I said, I'm
Well,
just
see, because
teaching her.
Noah didn't have room on the ark for the dinosaurs. What it
Yeah,
was.
clearly.
And then the other thing is that, what I've heard the creation scientists say is that the reason that you see more advanced animals higher up in the strata, if you go in and you find a place where there's lots of layers over the eons, and you dig down, you'll see simpler and simpler animals the farther down you go. And what they'll say is during the flood, the more advanced animals went to higher ground, and that's why you see that, okay, is that you'll see more advanced animals higher up in the strata. And then, but the question that raises is that you see clams everywhere from millions of years ago to now. So if their answer is right, then it implies that some clams were smarter than others and they got to higher ground during the flood. I don't know.
Or just luckier they got washed up to higher
Oh,
ground.
that might be. That's it, Dr. Scott. Anyway.
Yeah.
All right, here we go.
Oh, hey, guys. Thanks for the call. This is the Rowan County Redneck, and I wanted to know how do all the nerves in your rectal vault determine whether it's wait, let me get this alphabetical, a fart, a shit, or a shark? Thank you very much.
Yeah, so how do you know?
That could be the question of the day.
When you expel something, when you're getting ready to expel something from your rectum, how do you know it's a fart, a shit, or a shark?
A shart is obviously a mistake.
Yeah, so I'm going to argue, let's take that out
Take
of there
that one out of the
because you
equation.
don't know
Yeah.
that it was a shart because the whole
Until it's
reason
too
it's
late.
a shart was you messed up.
Until
Yeah.
it's too
So
late.
obviously the system isn't perfect. But here, Tacey, you have some wine
and experience.
and Scott, do you have? No, I didn't mean that.
Oh.
Everybody has a drink. Okay, so everybody take a drink real quick. Okay, we're gonna take a drink. All right. Now hold that in your mouth. Now, is it a fart, a shit, or a shart? I mean, is there water in your mouth, fluid in your mouth, or is it air? It's fluid, right? Okay, so let's think about how it's the same thing. You know, if there's air in your mouth, if you blow up your mouth with air, that's air.
Yeah.
And you know when there's liquid in there. So there are sensors that one of the things that liquid does, let's talk about it, is it exchanges heat more efficiently than air does.
Right.
So if you have hot water in your mouth, you can feel that as that there's something that is touching all the areas of the buccal mucosa and it's transmitting heat either into the buccal mucosa or drawing it away from the buccal mucosa if the water's colder than if you get water that is exactly the temperature of your body and you sit there long enough, it'll extinguish that feeling. You might not be able to tell. So, I mean, how do I know that I'm holding a phone in my hand? Sometimes when I'm sleeping, I think I still have my watch on my hand. So it isn't a perfect system, but it's pretty good. And from a evolutionary standpoint, it's very good because you don't want to be dropping loads around in your, if you couldn't tell, you'd just be dumping loads where you're sleeping. That would be a mistake, but it's okay to pass gas, right? Because for sanitation reasons, but also you don't want saber-toothed tigers able to track you to where you sleep.
Right on.
So, but the rectum has same sorts of nerves. They're just not as perfect. Now, you can't taste stuff, thank God, that's in your rectum. That would be horrendous if you were constantly tasting shit, in your rectum. But there is a person, and his name is Richard Christie. He worked for Howard Stern. He swore that if you poured different beers into his ass, he could tell the difference, and he could sort of taste them. Now, those have alcohol in them, and the alcohol may actually be absorbed and then draw in some aromatics with it. So I think he might be right on that. Would be an interesting test to do. I'm not going to volunteer,
Nor should we advocate for
alcohol in the
No. I would only do
stuff.
it for the science, not. I don't add. We've talked about it on this show multiple times.
Oh yeah.
Don't
do that.
Drink alcohol by shoving it up your ass.
Or on a tampon as a woman. That was popular when I was in college.
Well,
What?
Yeah, but did we debunk that?
She's
That was
wearing.
popular.
You know that you were. Well, maybe you weren't here. We did a vodka tampon challenge on the show. If you go back,
That poor girl.
in the
God
archives,
Almighty.
Get drunk.
because we said no, you can't get drunk that
Yeah.
way. The vagina is not designed to absorb things.
Okay,
If you
yeah.
took that tampon and shoved it up your ass, maybe, but even then, we also measured how much you could absorb into a tampon. It was less than an ounce.
Oh,
What about something like cocaine?
Yeah, maybe,
Possible.
but yeah, let's not give people
Sorry,
ideas.
guys.
But yeah, we took a tampon, saturated it in vodka. She shoved it up her vagina, and then we did a breathalyzer test every 20 minutes during the show, and there was nothing. It never
Nothing.
raised. And then she had an itchy vag for like a
Forever.
month.
I bet.
Yeah.
Man.
Yeah, stupid. And then we showed frat guys, fraternity brothers, sorry, Tacey, putting thimblefuls of alcohol under their eyelids. It's like, why are you doing that? First
Just
off,
drink it.
you can't, you can't get but a
Why wouldn't
thimbleful.
they? Yeah.
It's going to irritate your
Well, and the
conjunctiva.
eye can take a third of a drop.
Right.
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 One
And then the
third
rest
of
of
a
it
drop runs out.
runs out. It's idiotic. Just drink it.
Yeah.
If you're going to drink it, if you're going to drink. And then we talked about the guy that died giving himself champagne enemas. He did 2 bottles of champagne and then was watching doing autoerotic asphyxiation. And he died from alcohol poisoning, not from the autoerotic asphyxiation. You know, that wasn't the problem. He was breathing, or he had been breathing till he died. You know, and so don't do that. Another guy did a concrete enema. That was stupid.
yeah.
Don't do that.
Nope. Concrete, by the way, is an exothermic reaction, meaning it gives off
Gets
heat.
warm,
Really hot,
Warm.
baby.
And that guy cooked himself from the inside, died.
Yeah.
Yeah, you know how I know all this stuff?
No.
Was from this journal called the National Association of Medical Examiners. I was a medical
Oh,
examiner when I
nice.
lived in Vermont, and I joined, and it was their journal, and it was page after page after page of the most fucked up deaths you've ever seen. Yeah.
Wow.
So anyway, they love it, those guys. So
Oh,
anyway,
my
all right.
God. Yeah, the pathology department is.
Yeah, they're
One place
different.
in itself,
They're different. We love them, but they're
Yes,
different.
we do.
All right, now this person. Oh, Tacey, you need to listen to this one.
Okay.
Hey, Dr. Steve, this is Hoss. I just wanted to
Hey,
let
Hoss.
you guys know that I work for an oxygen company,
Okay.
and we had to send in all our ventilators to Philips for a recall. And Philips thinks that it's caused by ozone cleaners,
Oh.
but it also affects BiPAPs and CPAPs. And just thought you guys would want to know. Thanks. Bye.
Oh, and I've still been using my.
Yeah.
Oh no.
I quit using mine. I'm not saying you shouldn't use them. I don't know what the data is. If you go on those forums, and what we're talking about is like the ozone cleaner for CPAP machines, and they don't actually clean anything. They'll sterilize it.
Okay.
And you would think that would be a good thing, but if you go on the forums, they're all just anti this and that. But I can't find any data that shows it's harmful at all. Although I've been using ultraviolet cleaner for my retainer, for my Invisaligns, and the damn retainer cracked, and I think the ultraviolet has made the plastic brittle.
Wow.
They told me use the bright retainer cleaner, and it's just a pain. You have to put the little tablet in. It's like Polydent or not Poly. What's the one? Is it Polydent, the one that cleans your dentures.
We know what you're talking about.
I just felt like an old man.
It's Polydent.
Even more than I already do. So I got this ultraviolet thing, thinking, whoa, this is. I'm young and
Is it
hip.
short wave or long wave? What
I
does
don't
it
know.
say?
That's a
Well,
good
there goes
question.
another $7,000.
Yeah,
Steve.
I know. All right. So anyway, check check your manufacturer's recommendations and check with your provider whether your ozone cleaner is okay.
I mean, I wish we had the answer to that question.
I know.
I
Well,
mean,
there's people doing research on it. I know that.
for myself and for everybody else.
Yep. All right. Well, let's look that up. See if there's anything more definitive out there for next week. All right. This is a weird one.
Hey, Dr. Steve. My name is Elliot.
Hey,
I was
Elliot.
just recently offered a job in a New York City hospital, and Long story short, back in November of 2020, I was a participant in the AstraZeneca trials.
Okay.
And I took both shots. Subsequently now offered a job in hospitals over here in New York, and they're not recognizing the AstraZeneca as a vaccine shot. And they want me to take 2 more shots. Is that something that is safe to do? Thank you.
Wow.
That's a tough one.
I'm looking here that says, now this is from nycgo.com. For travelers to New York City, vaccines listed for emergency use by the World Health Organization, such as AstraZeneca vaccine, as well as FDA or WHO approved mixed doses qualify. So isn't that interesting?
Yeah.
I wonder what that's about. I could not find anything on this. The WHO recommends all countries accept all COVID-19 vaccines, including the 2 made in China, AstraZeneca, one of the ones in the UK, and then Pfizer. So,
Was the AstraZeneca an mRNA vaccine as well, or?
AstraZeneca was a weird vaccine. It used a viral sort of Trojan horse.
Okay.
And so it was different, but it was shown to be not as effective, but it was still effective. So I don't know. We'll have to do some more research on that. Will you leave me a note, Dr. Scott,
Sure.
and we'll see what we can find out for him. In the meantime, I would question it and send us the policy. We'll look and see. Number one is, can they do that? Well, employers can either mandate or not mandate vaccines, however they want. Apparently, I was looking at, particularly in New York, I was looking for some OSHA regulations on this as well, and so I'm just going to say I don't know what the hell I'm talking about right now. So, here we go. Medical workers ask Supreme Court to block New York vaccine mandate lacking. I don't know. So, we will do more research on this one and get back to you. Okay? So next week we'll have a special episode on AstraZeneca. All right.
Hi, Dr. Steve. What's up, guys?
Hey, man.
Hey,
All right, what's up, buddy? How y'all doing?
Good. How are you?
Awesome.
All right. Good time. So what had happened was Santa left a woman that wasn't clean, apparently.
What?
So we were forgetting.
What?
Santa left
Jostle about and kind of hurt my D a little bit. You know how it is. But
I don't.
No.
Afterwards, it continued to hurt.
Okay.
Like for a day or two.
Okay.
Nothing, too out of the ordinary. Just a little soreness, a little tenderness. Now, there's a bit of a discharge.
Oh no.
From the meatus.
The meatus.
And I'm a little. I made up with the doctor tomorrow.
Okay.
But no buts. I just want to let you know I'm having sex. Yeah! Woo! No.
Congratulations, bro. So he's having sex.
Dirty
and-
sex.
It sounded like he said Santa left a woman that wasn't clean.
That's what he said.
Okay.
Yes, I think over Christmas he had intercourse.
Sounded
and,
then I thought he might have had penile trauma, but no.
That's what I thought
That was
too.
a lot.
Yeah, but if you fracture your penis, which is a possibility, that the pain doesn't go away in a couple of days, and that ends up being a medical or a urologic emergency. But then he had yellowish discharge, so that's more likely to be trick or gonorrhea at that point. So get that taken care of. That one's treatable, easy to treat most of the time. There are some resistant strains to gonorrhea now, but we have treatments for this. So
And congratulations
on having intercourse.
That's great.
What's that like?
I wouldn't know.
Shut up.
Hey, Dr. Steve, to answer your question about flavors being lost during COVID a couple of shows ago.
Yeah.
I, in fact, did experience that in May of 22, and I lost everything except sweet.
Except what?
Now, it came back maybe about 6 months after, so that's long ago.
Okay. So he had loss of something.
Everything but sweet.
Oh, sweet. Everything
That's
but
what I
sweet.
thought he
okay,
said,
okay,
too.
Okay. Yeah, and that was back in May. So we were talking about just, we're not seeing this now. Back when this thing first started up, that's how people knew they had COVID, was they lost their sense of smell. Or not everybody, but a lot of people did. And now people just have colds or they don't have anything and they test positive for COVID, don't even know it.
I did go to dinner with someone 2 days ago, and she recently recovered from COVID. It was right after Thanksgiving. She lost her taste and her smell.
Huh.
Strange, right? Healthcare worker had COVID before. Wow.
Wow. Well, most of the cases we're seeing now are serendipitous. They come in for an elective procedure, and then they test them before they do it, and they're testing positive. They had no idea.
Yeah. Thank goodness.
Yep. Agreed. All right. So, and that's the thing. And then everybody freaks out. And I'm going to say this again. I've said it before on this show. There's 5 other endemic coronaviruses. We don't test for those. Now the 6th one was novel, and it caused no end of chaos, but now it's becoming endemic. It's just out there, obviously, because like I said, we're just finding it serendipitously now. Still rough for some people, no question about that. But, the other 5 coronaviruses aren't innocent either. They cause death and mayhem, too. It's just that back in the day before 2020, we didn't test for them. We just said atypical pneumonia, viral pneumonia, and people died from atypical or AKA viral pneumonia, and we never knew what it was. Now we can test for this one, but those other 5, if we tested everybody that had a cold, they're about 40 to 60% of them will have coronavirus of some sort.
Right.
And but we test for this one, and now it's special. And, people have to not go to work for 7 days, and they have to isolate, and they have to do all this stuff. So at some point, we're either going to have to test for all these viruses, or we're just going to have to stop testing for it. Because at some point, it becomes pointless. But anyway, I know we haven't quite gotten to that point yet, but this is another person that had a COVID issue.
Hey, Dr. Steve,
Hey,
just
man.
listening to your recent episode talking about if recent COVID strains cause, a loss of taste. And I'm just getting over, I don't know if I didn't test myself. I don't know if it was COVID or the flu or whatever, but, I kind of had the flu/COVID symptoms, cough, fever, body aches, etc. And then at the end, everything started tasting very bitter. Or I just had a low-level bitter taste in my mouth, so things like alcohol and coffee would taste really, really bad. And it's been 3 days maybe, and it's starting to get better, but still not quite there. But I didn't quite lose a full sense of taste, but my taste buds were definitely changed.
Yeah. So there's lots of things can cause bitter taste in your mouth, though,
Divorce.
Okay, I gotta give
Give yourself a bill.
One, yes.
The process.
Just at the end of the class. Just in the nick of time.
You are one pathetic loser.
Well, yes.
I don't think
That's
so.
okay.
No, I was directed at me, too.
Yes, that's what I sort of started to say. It's not just you, Scott.
No.
Lord have mercy.
No. Yeah. So divorce, oral health issues. GI issues can also do it, acid reflux, but supplements and medications. So some things that you might take during COVID, like vitamin D. What do you?
It's hot in here again. It's hot in here again.
Vitamin D, iron, calcium, but people will take vitamin D when they have COVID-19. That can cause a bitter taste or metallic taste in your mouth. And stress and anxiety can cause alterations of the taste in your mouth as well. Anxiety can cause dry mouth, Do you know the medical term for that? Anyone? PA Lydia?
I can't remember right now.
Xerostomia.
Xerostomia. Yeah.
But in this case, it was temporarily related to the patient's COVID-19, so we're going to just assume it was that. But that's interesting. So we are, Scott, getting a few people that are calling in saying, yeah, we're still seeing these symptoms out there. You and I haven't seen it, but they're still having
I
it.
wonder. So in chemotherapy, right,
Yes.
when you get taste alterations related to chemotherapy, there's some data for sublingual B12. There's a
Mhm.
trick where you do a super, super sour candy.
Yeah.
And it temporarily restores your taste. And all of, we think that the COVID taste disturbance may be related to neurological
Yes.
impact, right? So I wonder if it might be helpful.
Well, that's interesting.
So I don't know.
Worth a try.
Yeah.
When I had Delta variant, I used Flonase the whole time because it just seemed like it made sense, and I never had any changes in my. I lost 1/16 of my lung to scar tissue, but I didn't lose my sense of taste, and I attributed it to that, or I may not have lost it at all, but there is a little bit of data that says if you start using Flonase or other nasal steroids at the beginning of the syndrome, that you may be able to prevent this. So that's something, but that didn't hurt anything.
Something that's not hurtful, yeah.
Yep. All right.
Namaste. What's up, fellas? How's life?
It's the same.
Well, mine is a peachy keen. So I went to the doctor yesterday. Well, hey, doctor, or saw the nurse lady or somebody. I got some doxycycline caps.
Excellent.
100 milligrams, 14 of it, for my drippy dick. Yeah, apparently.
Oh, this is the sequel.
That's a lucky woman that wasn't clean. And this bitch. But anyway, while they were checking me out and stuff, nobody even looked at my dick. So I was kind of like,
Oh, that's not cool.
No, that's not good.
No, if you're going to treat STDs, you got to look at it. You got to look at the genitalia. You need to stick the swab up there. That's always fun. Is this little tiny swab, and they stick it up your urethra, and then not only does it need to sit there, but they have to twist it, and it's the twisting that gives you the abject agony. And I can't speak from experience on this one, but I have done this procedure on other people, and this is what they tell me. And then you culture it, and then that way you know if you're treating what you think you're treating.
Right.
To hand people doxycycline. Well, anyway, hopefully it gets better. So
not special, I guess. But they checked my blood pressure, and it was like 180 over 80, I want to say, 80 or 60.
yeah, that's high, but it was probably because you were getting
Yeah.
STD treatment.
You might have
so
expected.
yeah, you might have expected the swab up the dick because you listened to the show, and as we talked about that multiple times, that's the correct way to do it. So just get your blood pressure checked again.
Yeah.
And if it's back down, you can forget about it. If it remains elevated, get that treated because hypertension is the silent killer. Yes. Thank you. All right. Let's do this one.
Hey, Dr. Steve, Dr. Scott, Dr. Casey, how are you guys doing?
Good. How are you?
Doing well, thanks.
Lift up PA Lydia.
I had a question about cancers that are caused by exposure to toxins like mesothelioma with asbestos or these rare cancers from people who were involved in ground zero cleanup. Does the cancer or like the cell mutation start at that moment of exposure and it just takes years, before it gets big enough to where it's detectable or causing symptoms, or does it, start some chain of events where it's in some latent phase and it's a ticking time bomb that starts causing cancer years down the road?
Yeah.
I'm just wondering, like these cancers from one-time exposure or like in a short period of time, how it causes cancer years later.
Yeah, that's a good one. So let's talk about asbestos. So asbestos is this mineral that you can pull apart into little fibers. And so they used it for insulation for years. And when you inhale that, which I used to go gem mining in an asbestos mine. So, and by the way, if you've been exposed to asbestos, just don't smoke. That's the big thing. If you smoke and have asbestos, then that's a real problem. But the body can't break these things down, and they get stuck in these tissues, and they start causing inflammation and irritation. And over years, they'll cause inflammation that'll change the DNA of some of the cells around them. And let's just say it's 1 in a million, and you affect 100,000 every year. Well, then in 10 years, one of those cells you would expect would convert to a cell that could reproduce itself. It's unlikely, if you damage DNA, that it's going to be anything functional, right? It'll just kill the cell. But every once in a while, you'll damage the DNA in such a way that it'll start growing like crazy, and it's successful. And when that happens, then that's basically cancer, because it's growing. It's not supposed to be growing that way. It's supposed to be regulated, and it's not listening to the signals trying to regulate it. So anyway, and yeah, so then that's what happened. So it could happen the first time, but it'd be very unlikely. It'd be like hitting the lot. It's like hitting the lottery. So I've heard the lottery described as if you take pennies and you stretch them from New York to L.A., and you take one of those pennies and paint it blue on the other side, and then you drive from New York to L.A., and you stop somewhere along the way, and you pick up one of those pennies, and it's the blue penny. That's the same sort of odds of winning the lottery. So that's the same sort of thing here, is that it's very unlikely. But then once it does happen, once you win, someone wins the lottery. Once it happens, then the cancer is inevitable at that point. All right. Okie dokie. I do want to talk about this one. I hope.
Hey, Dr. Steve. I'm the one that called you a couple weeks ago about the antibody level with the COVID vaccines and having the rough time with the third booster.
Yeah.
So my COVID antibodies were a COV2 and IgG2 antibody screen, and it was greater than 25,000 units AU/ml. It stated that anything over 50 units was considered to be high.
Yeah.
The reason I'm concerned is because I do have an autoimmune. I'm a teacher. I work as a paid EMT, and I am exposed on a regular basis. And also, when I contracted H1N1 and H1N2, I had a pretty serious reaction where I ended up nearly on a ventilator with
Yeah. I think that there's... What happened to the volume? Sorry. I think that there's an argument you could make that says I've already, I have these huge antibody levels. Don't pose a danger to anybody, and you could probably get out of doing those other vaccines, and you just have your rheumatologist write a letter or your primary care. I think that's fine. I don't see any problem with that. And natural immunity is kind of interesting. There was a study, and I talked about this on Twitter, and we have a little bit of time left. And this is a journal article from the American Journal of Public Health called SARS-CoV-2 Infection, Hospitalization, and Death in Vaccinated, and then in unvaccinated but infected individuals. So they were looking at the difference between vaccinated people and people with natural immunity. And what they found was that there was a 37% decrease in all-cause mortality in people who were vaccinated compared to the people with unvaccinated, who were unvaccinated but had natural immunity if they got it again. Now, 37% sounds huge. You know how many? So there were 34,000 kids in here, and you know how many of them died over this period of time? And it was 12 months. 4. And how of the previously infected, the natural immunity but unvaccinated kids? 6 out of 34,000. So that's just for the kids. The adults showed higher numbers, but this is all-cause mortality. This doesn't say that they died from the virus. Okay, it's all-cause mortality. So the absolute risk, even in the adults where the numbers were more like, 60,000 and, people and 250 deaths compared to 400 and something, whatever, the absolute risk was still very, very small. So what the interesting thing in this is both sides, sadly there are sides to this, can say, we're right. If you're pro-mandate, you can say 37% decrease, okay? Or if you are anti-mandate, you can say the absolute risk is 0.0002, Both of those people are correct. That's the problem. And that's why it's so hard for us to reach any kind of consensus, because we're all cherry picking the statistic that says the thing that we want it to say. And they're both right. Neither one of those is wrong, you know? So anyway, all right, very good. That's all we got time for on this side. Hang on. I got distracted, sorry. Which is basically the same way of saying the same thing. It's, yes, they're right, and neither one of them's wrong, so I'm a dang genius. Anyway, thanks, everyone at SiriusXM, whose steadfast support of this show has gone and sustained us over the years. Thanks to Dr. Scott, Tacey, P.A. Lydia. And thanks to Lewis Johnson, Jim McClure, Sam Roberts, Jim Norton, Travis Teff, Troy Henson, Paul Ovcharsky, and Roland Campos. And thanks to our listeners, particularly. And go to our website at drsteve.com. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get us some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you, guys.
Thank you.
Bye. Thank y'all. Happy New Year.
Oh, I cut you off. Sorry.
It's okay.
Happy
New Year.
Well, I'll fade you out of that, but it'll sound like you said the whole thing. All right. All right.
Cool. That was a question heavy set.
It
That's
was,
good.
yep. All right. Anything from the waiting room, Dr. Scott?
Lovett was wondering if 11.5 white blood cell counts high.
Okay.
Slightly.
Yeah.
That's a good one for the hematologist to answer.
Yeah.
Okay.
Yeah. You get Lydia.
All right. You ready? Hang on.
Three 347-766-4323. That's 347-POO-HEAD. Yes, that's a real phone number chosen by a grown man in the medical profession.
All right, Dr. Scott, you had something from the waiting room before we get out of here?
We do. We have a question from Lovett. She's wondering if a white blood cell count of 11.5 is high.
Okay. So would that be chronically high? Or is it just intermittently? I mean, just a one-off. So
assuming it's one-off, because she didn't say it was chronically high.
Okay, so let's talk about both. P.A. Lydia,
Yeah.
this is your realm.
Lots to unpack there.
Yes.
So, yeah, if whether chronically or not, yes, technically it is. So anything over 10 or 10.0 or in our world 10,000 is high. So 11.5 would be 11.5 thousand. So it's technically elevated. So the next thing to
What
look
is that,
at
11.5 thousand per high-powered field, or is that cells per deciliter? Or
I
what
thought it
is
was
the
cells per
units of that?
deciliter.
Okay.
Take a peek.
I will. I'll look at it.
And so that would be your total white blood cell count. So then, the next thing we look at is that chronic or is it acute? And
Per
then
microliter.
what type of cells are elevated? So are they your neutrophils? If your neutrophils are more predominant, you would think about more like bacterial infection, more lymphocyte predominant when you look at the differential or the breakdown on your lab sheet.
Okay.
You might think more about viruses, maybe chronic inflammation. Eosinophils being elevated. You might think more about allergies.
What are all these different cells?
Yeah.
So you said neutrophils, lymphocytes, and
just
eosinophils.
types of white blood cells, right, that make up your immune cells, and they are targeted and powered to impact different things, whether it be bacteria, viruses.
And they look different under the microscope. That's why they called them that, because the eosinophils took on more eosin, which is a red pigment. And, they wash these things with red and blue pigments, and then you look at them under the microscope. Some of them will not hang on to the blue, but keep only the red. And the neutrophils, I guess, did a little bit of both, because they are kind of purpley looking. And then the lymphocytes have bigger nuclei compared to the cytoplasm, compared to, say, a neutrophil. When you're thinking about it, if it's a chronic thing, which we get referrals quite often of chronic. Well, you guys get referrals for people who have, a slight anemia and stuff.
So, probably the second most common to anemia would be the elevated white blood cell count.
Yes.
So the first thing we do is we look at what type of white blood cells are elevated. And then, you can do something called a flow cytometry if it's something that's very chronic, meaning it's lasting for a long time, just to make sure none of them are cancerous. However, one of the most common reasons is something that induces chronic inflammation in the body. So something like cigarette smoking or chronic stress or chronic illness.
Really?
So those are the most common causes of a chronic mild elevation in your white blood cell count.
Okay, so now what do you do? So you're at your primary care physician's office. They say, well, you've got a white cell count that's high. I'm going to send you to the hematologist. What should you be worried about it? What's the deal?
No, the vast majority of the patients we would take a peek. We would make sure that there's no sign of malignancy or concern for malignancy, and then kind of the chronic inflammation, stress, or exposure to tobacco smoke would be a diagnosis of exclusion. And you just monitor it every few months, make sure nothing changes.
Yeah. What about these people that have monoclonal gammopathy of uncertain significance?
Mm-hmm. So that would be something that we...
What is that?
So...
I mean, I know it.
Yeah. So one type of your white blood cells, or closer to a stem cell, is called a plasma cell.
Mm-hmm.
And a plasma cell exists in your marrow. It starts to mature. It should be exposed to an antigen or something like a virus, and then go back and its job should be to make antibodies to a certain virus or to a certain antigen.
And they remember it.
And they remember it, and those antibodies are proteins, and they come. Those antibodies are immune globulins, have light chains and heavy chains, and so sometimes a plasma cell line can get mutated, or a plasma cell can get mutated, make more of itself, and make an abnormal protein.
Yeah.
And so when you look at someone's protein under mass spectroscopy, where you actually go and you kind of sort out all of the proteins in the person's blood or in the person's plasma, if you see a spike of a certain protein that is a nonsense, but that is a clone, so they're all the same, but they're not really encoding for anything, that is monoclonal gammopathy. And as long as that patient doesn't have other signs of malignancy, like trouble with bone lesions, kidney disease, low blood counts, it's undetermined significance.
Mm-hmm.
So it's like something that has the potential to turn into malignancy. It's not malignancy, and we monitor it.
What are the odds that that'll turn into a malignancy?
It's 1 out of 10 per year. So you've got like a 10% risk per year.
Okay.
So if you have, and I'm going to stop myself, but the longer you have MGUS, the more likely you are to develop into a cancer.
But at every year, it's still 10%. So if you have a 10-sided die, you could roll. If you had a die that had 10 sides and there was one blue side and 9 red sides, you could roll red sides for the rest of your life. It's not impossible.
Correct. Yeah, but the risk does go up the longer you.
Okay.
Are living with it.
Very interesting.
Just monitor.
All right. Well, thank you. You got anything else out there, Scott? They're probably sorry they asked now.
No. That's no. Lovett said thank you. She said her neutrophils were 78/84.
Yeah, so that's a little bit higher of a percentage. So maybe she's overcoming some recent bacterial infection. It could also be a stress.
Well, yeah. One thing is when you see an abnormal lab test and it's just out of the blue, the first thing you do is repeat it.
Yes.
Because there's this thing called regression to the mean, where you will often, if you have a aberrant lab test, then you do it again. It's normal. If you do 20 lab tests and they have a 5% margin of error, that means it's very likely one of them will be abnormal, because of lab error. Right? And it's not that they made a mistake. There is a margin for error in all of our tests. None of them are so precise that there's no error. As a matter of fact, you could not make a test that had that. It's not physically possible in this universe to make one that there will always be some error no matter how precise you make your measurement. So,
yeah, I get tested again. So if she had a white count of 11.2 0.2 and it was 80% neutrophils, that's an ANC of 9.2, which
Yeah.
is significantly.
Absolute neutrophil count.
Yeah.
Jargon alert.
Yeah, sorry guys. So,
That's okay.
I mean, that's something to make sure you don't have any signs or symptoms of bacterial infection, a sneaky urinary tract infection that could be going on,
Yeah.
and have it rechecked.
Well, you women are always getting your cystitis, don't you?
Yeah.
with your monthlies.
Pee after sex.
That's right. There you go. Very good. Yes. You're not kidding. That's a serious answer.
It is.
All right, very good. Well, listen, thanks always go to Dr. Scott. Thanks, Tacey. Thanks, PA Lydia. Thanks to everyone who made this show happen over the years. Listen to our Sirius XM show on the Faction Talk channel, Sirius XM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.
Happy New Year.
Happy New Year.
Happy New Year. All right, let's do the opening, and then we'll be done.
Cool.
Well, you'll be done. I've got work to do. All right, let's see here.
Do you like it on Saturdays?
I do.
Yeah, it's cool, right?
I
It's
forgot
relaxed.
about it. I didn't get up till.
Yeah, we were like, oh, we got all Saturday. We didn't have to do
and then
anything.
it's like,
And then
Maybe-
it and
you
then
sent
it
that
kinda,
text,
yeah.
and it's like, holy shit.
Yeah, we used to do 3 of these on a Saturday. And so
Which
we
was
would meet
too
every,
much.
every third week.
Yeah.
But maybe some week we could do 2 and then just
Yeah, that'd be cool.
take a week off or something. Anyway, all right. Here we go.
It's hot in here.
Oh,
It is.
Why are cats such great bakers? They make everything from scratch. What did the stuffing say to the turkey? I'm so into you. I decided to sell my vacuum cleaner. It was just gathering dust.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled?
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And in the studio, Tacey, my partner in all things, Tacey. Hello, Tacey.
Hello.
And back from sabbatical, PA Lydia.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question, you're embarrassed to talk to your regular medical provider. Oh, my God. If you're embarrassed to take to your regular medical provider, or if you just can't find an answer anywhere else, give us a call at 347-766-4323. That's 347.
Poohead.
My brain got ahead of my tongue. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. And most importantly, we're not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on the show without talking it over with your healthcare provider. All right, very good. Please don't forget to check out stuff.drsteve.com, stuff.drsteve.com. Our website's a little weird right now because I've been working on it, but stuff.drsteve.com still works. You can go straight. You didn't get that widget that you wanted for the holidays? Well, go buy it for your damn self. You're an adult. And you can do that at stuff.drsteve.com. Just click straight through. Really helps keep us on the air. And simplyherbals.net. That's simplyherbals.net. That's Dr. Scott's website. Check it out for your CBD, nasal spray needs, and all kinds of other stuff like that. And then Tacey and I are on Patreon, patreon.com/weirdmedicine. Finally, the Chad Zumach episode is out. It's there. After all of this, talking about how I was going to edit it and chapterize it and try to make it make sense, because it was one person with ADHD talking to another person with ADHD, I just said, screw it, and I just threw it on there as it was. And actually, I think it probably makes more sense to do it that way.
Probably does.
And Dr. Scott was on that.
I was on that one. Yeah, that's a good show.
It's the only time he's been on Patreon.
Yeah.
But patreon.com/weirdmedicine. We've had Pete Davidson. We've had the Troika of Opie and Anthony. We're going to, Joe List and Kevin Brennan are coming on. We're going to have some interesting people on over the next few months. So check that out. And then if you want me to say fluid to your mama, or if you want Myrtle to...
you don't want Myrtle.
I put that... 2.5 minutes. P.A. Lydia, were you here that
I
day?
was.
Okay,
It
yes,
was
you were,
wonderful.
because I have
she
video
was.
of you laughing.
She was here.
But yeah, this person called and asked, or in Cameo, said, "Can you do that old lady character? Because my wife hates it, and can you do it for a really long time?" And Myrtle can just talk forever. So if you want me to put the wig and the teeth on, that's the same price. It's $9.
The same price, everyone.
That's right.
Low price.
So cameo.com/weirdmedicine. Anything else?
I believe that'll do her.
All right. Okay.
Cool. You have a thing from Eric Andre?
Yes.
That's cool.
Yeah. Where's it on the floor?
Yeah, it's on the floor over there.
Oh, yeah. Hear him.
I love Eric Andre.
I do too.
You want
Tacey hates him. Yeah. Can you hand it to me?
Yeah.
I just want to show everybody. My favorite thing is Louis C.K. I have a picture with him, and he just wrote UGH and put an arrow to my head. Yeah, here's my Eric Andre thing. I don't know if they can see it or not.
I don't hate him. I just don't understand.
You hate his show. You liked him in The Righteous
It's like
Gemstones.
abstract comedy, right?
Yeah, it's surreal. I love
Something
surreal.
about a pizza ball.
It's we knew we were going to love him the first episode when he was the blind guy and he had his dog and he's standing outside sort of a Quick Mart and this lady walks by and says, "Excuse me, ma'am, have you seen my dog?" And she's like, "Yeah, he's right there." And he whips off his glasses and he has no eyes. I mean, there's no eyes there. It's just blank. And he goes, "Describe him to me." And the woman got so scared. And then they just freeze frame it. But the makeup was great. He looked like anyway, freak. Here you go.
Thank you.
Thank you. All right. Scott, are we playing some music? They can't hack the heat up here. I don't know what they're talking about. You even were saying it's hot.
Ooh, it's hot.
I think it feels good up here.
I've got thyroid problems, so I'm happy.
I have thyroid problems too.
Okay. It's the thyroid girls. Okay.
You got Hashimoto's?
Took my dang supplement. I don't think so.
How about hitting a little bit, just a little bit of AC? How about that?
You want some AC?
Oh yeah, please.
Yep. Okay.
No, we're have mercy. Lord have mercy. Lord help.
We gotta do something about this up here. The studio is great. But
Yeah, no, studio's fabulous.
maybe we'll move it.
No, hell no.
I still think the storage thing, if I could find a storage unit that's climate controlled that has electricity in it, we could just do it there. But there'll be a lot of clanking and moving around,
No. Let's just use some of that weird medicine money and buy a Sprinter van. Then we can record in a Sprinter van. We can take it on the road. Like those Mercedes Sprinter vans. That sounds like
I don't know.
Sound like a.
Why does it sound like this?
Band.
Well, it sounds bad because of the damn air conditioner.
You think that's what it is?
All right. You're going to use the other mic?
Yep. Just sleeping over here. Let's see here. We'll play.
Oh, no. You tell me.
Well, you know what I was going to do was "Christmas in Prison" by John Prine.
Okay, let's do it.
Yeah, let's do because we were going to do that. For
We were going to
Christmas.
do it? Yeah. Okay.
"Christmas in Prison" by John Prine, and it'll be awful, but it'll be okay. It's in G. Well, it's Christmas in prison, and the food was real good. We had turkey and pistols carved out of wood. And I dream of her always, even when I don't dream. Her name's on my tongue, and her blood's in my stream. You got it? You find it?
Yeah.
Okay, okay. Yeah. So here we go. Well, it's Christmas in prison, and the food was real good. We had turkeys and pistols carved out of wood. And I dream of her always, even when I don't dream. Her name's on my tongue, and her blood's in my stream. Wait a while, eternity. Old Mother Nature's got nothing on me. Come to me, run come to me now. We're rolling, my sweetheart, we're rolling by God. She reminds me of a chess game with someone I admire, or a picnic in the rain after a prairie fire. Her heart is as big as his whole goddamn jail. She's sweeter than saccharin at a drugstore sale. Wait a while, eternity. Old Mother Nature's got nothing on me. Come to me, run to me, come to me now. It's rolling, my sweetheart, we're flowing, my God. Searchlight in the big yard sings round with the guns and the spotlights and the snowflakes like the dust in the sun. And Christmas in prison, there'll be music tonight. I'll probably be homesick. I love you good night. Wait a while, eternity. Old Mother Nature's got nothing on me. Come to me, run to me, come to me now. It's Christmas in prison. I love you.
See, you want to do the run. Okay.
You like this song?
Yeah, it's good. I got to figure out a bass line that's not just completely boring.
I can, I'll sort one of the Highwaymen. Oh, we could do a highway. Hey, Amanda's going to be in Chattanooga tonight, too.
Really?
Well, she's going from Florida to Atlanta to Chattanooga. Yeah, Amanda, if you make it through Atlanta, you got a chance to get in Chattanooga. You only have about another hour. It's getting through Atlanta that's tough. Blackberry Smoke. Oh, I love Blackberry Smoke. Yeah, propane, Bonafide, they all agree. We need a sprinter van.
Need a what?
A sprinter van. Colin, if you send an email, send it again, please, because I did not see it. I don't know if Dr. Steve saw it. Talking about RA and fibro. No, not RA and fibro. Fibro and lupus. I think that's right.
Well, I ain't heard tell of such.
Yeah, make sure you send it again. Make sure you send it in. Yeah, I love Blackberry Smoke.
What is that?
The Blackberry Smoke's a group of hillbillies there that actually are really good musicians. Yeah, I went through that a little too quick for the Christmas in Prison song. You could have played some nice bass runs in there if I'd have just strung it out a little bit. You know?
Oh, well, you didn't need a bass player on that one.
There you go. Yeah. That's perfect. You gonna do her one more time?
Nah.
You gonna do something else? What you gonna do?
Yeah, what else you want to do? What else were we going to do for Christmas?
Well, that was my main Christmas.
That was the one?
That was my main Christmas song. We could do T for Texas. T.
What is it?
T for Texas. Old Tom Paul Glazer. I heard that today.
Okay.
I don't know if I can get that. T for Texas. T for Tennessee. T for Texas, T for Tennessee.
We playing the Johnny Cash version?
Yep. The Johnny Cash version. I don't like the D though.
Well, Katie, what is it?
T.
Do it C.
You want to go C? Yeah, I think that Johnny's a little stronger than I am. T for Texas, D for Tennessee. T for Texas, D for Tennessee. That girl Thelma, he made a wreck out of me. Yeah, I think C word. Yeah, there you go. I like that. Kick it off for her, Dr. Steve.
Are we doing it in C?
Yeah, let's do it in C, yeah.
Okay.
T for Texas, T for Tennessee. T for Texas, T for Tennessee. That girl Thelma made a wreck out of me. If you don't want me, mama, sure don't have to stall. If you don't want me, you sure don't have to stall. I get more women than a faster train can haul. Gonna buy me a pistol as long as I am tall. Gonna buy me a pistol as long as I am tall. Gonna shoot poor Thelma, just see her jump and fall. If it's your mama, you better tie her to your side. If that's your mama, better tie her to your side. 'Cause she flags my train, I'm sure gonna let her ride. Gonna buy me a shotgun, great and Liney Bear. Gonna buy me a shotgun, long and shiny barrel. Gonna shoot that rounder, he stole away my gal. I'd rather drink muddy water, sleep in a hollow log. I'd rather drink muddy water, sleep in a hollow log. And then stay in Atlanta, get treated like a dirty dog. Well, T for Texas, T for Tennessee. T for Texas, T for Tennessee. That girl Thelma, she made a wreck out of me. The brakes on the train. I didn't know where to go after that. It was such a train wreck.
I like you playing the chords and the lead at the same time. When did you learn how to do that?
I don't know. I just farting around.
Yeah,
farting around there.
That's way better than having a bass and a single note bass and a single note guitar at the same time.
Yeah, it is. That's a fun song though.
Yeah, that's a good one.
Yeah, I'm glad
add that to my favorite.
Yeah, we got to put that to the resume. Let's do. Let me get the mail on out. What do you think about? What do you want to play?
Oh, what?
I don't know if
Did we
anybody's
ever
got
play
any-
that?
Anybody got
that traffic song? I'm looking
request?
for a girl who has no face. You remember singing that? I'm looking for a girl that has no
Thanks, Sean.
face.
That's a great tune. We'll practice that. We can actually play it a little bit
She has no name.
better. I don't remember that. You can if you'll sing it, we'll play it.
Number. I could probably try to sing.
That
I
Cardiff
can't sing.
Electric thing you sent me sounded pretty good.
Which one?
The final-
English version?
The one you.
Oh no, the one that we did.
Yeah, the one you sent me. Actually
Well, the one that you and I did.
Yeah.
Yeah.
The one you sang, yeah, sounded pretty good.
I didn't.
And all I did was play Madeline. It was wonderful. It was wonderful.
No name, no face, no number.
You find what you want, and I'll get tuned up, and we'll play it. Come here, baby. Come back to E.
Okay. There's Brian Ferry version. Did he do it too? Oh, I'd love to hear the Brian Ferry version. Let me see.
Hey, Kush, how
Oh,
cold
yeah.
did it get up there on you guys last weekend? Sean, how cold did it get up there on y'all? It was 0 here, minus 20 wind factor.
Let me see here. She has no name or number, and I search within, then so I search within this lonely place, knowing that I won't find her. Needs to be a little higher.
Kick it up one. Soft. There it is.
Ruling my mind, I feel no sound. I know we did this. Don't know where I'm bound, 'cause I'm looking for a girl. Nah.
I don't remember that.
Yeah, you sang it, or maybe I sang.
Yeah, you'd have to, because all right, we're getting close. All right.
You want to try it?
You gonna sing it?
Yeah, I'll sing it.
Single digits. Oh, I bet you guys are cold, Kush.
So, go to and just put in no face, no name, no number, and then do the Brian Ferry version and transpose it to E.
Gotcha. Brian Ferry. A, B, C, D, E. I'm looking for a girl who has no face.
Yep. See it?
Yep.
You transfer up to E?
Yep.
Oh, yeah, you might want to play this on the guitar. Well, okay, if you can do it on the mandolin, it's
I can
fine.
do it.
No, it's fine. It's fine. It's fine.
Either way. Either way.
Let's hear the chords.
If it's too high,
It's slow.
okay.
So I'm looking for a girl who has no face. Like that, okay?
Okay. A swingy?
No, it's slow.
It's okay.
Looking for a girl who has no face. A minor. She has no E. Or B7. And so E, I search with E7, this lonely A minor, knowing that E won't be 7. Well, E can't stop this E7 deep in A, and then it does a step down.
A, yeah. A, B, B7, yep.
Rule in my mind, that's the B7.
Gotcha.
Then it sits at E minor. I feel no sound, don't know where I'm B. Yeah. And then it just goes back to, I'm looking for a girl who has no face. Okay, you ready?
Yep.
All right, let's hear it. Do the intro. looking. No. Okay, let's do the intro. You ready?
Yeah.
It's not that slow. You ready? 1, 2, 3, 4. No, god damn it, play the fucking chords.
I played it. It's an E.
Just play the chords.
Oh, okay.
Jesus,
That's
I'm
an E.
nervous enough singing. Okay.
Yeah, ready.
Okay, ready?
E.
Start over.
Okay.
The intro. 2, 3. Okay, it's my E. Okay, it's 2 beats for each one of those.
Okay, okay.
So it's E7.
Okay. All I got to do is say 2. I got it. Yep.
E, I'm looking for a girl. Okay.
You do good.
No, it's I know, dude. It's I'm looking for a girl who has no face. There you go. She has no name or number. That's the B sub. So that one does 4. And so I search within this lonely place, knowing that I won't find her. Well, I can't stop this feeling deep inside of me. What? It's
E.
But then it's with the G sharp.
Oh, is that for me? The G sharp's for me too?
No,
that's for you, isn't it? Yeah. Okay. I was the E. I was holding for the B.
Yeah, you just do the E.
Yeah.
Yeah. And then I'll do the
walk down. Yep.
Yeah, the walk down.
And I'll come in there with that B.
Okay. All right. You ready?
Yeah.
Yeah. Start from the beginning. Okay. 2, 3. I'm looking for a girl who has no face. She has no name or number. And so I search within this lonely place, knowing that I won't find her. Well, I can't stop this feeling deep inside of me. Ruling my mind, I feel no sound, don't know where I'm bound. I'm looking for a girl who has no face. She has no name or number. And so I search within this lonely place, knowing that I won't find her. Well, I can't stop this feeling deep inside of me, ruling my mind. I feel no sound, don't know where I'm bound. The scenery is all the same to me. nothing has changed or faded. Well, I'm a part of it, some part of me, painted cool green and shaded. So try to find myself must be the only way to feel free. I feel no sound, don't know where I'm bound. I'm a-looking for a gal who has no face. She has no name or number, and so I search within this lonely place, knowing that I won't find her. Well, I can't stop this feeling deep inside of me, ruling my mind.
Beautiful.
I think if you played the guitar on that one and just strummed it, it would sound better. But it was funner doing it that way because it was shittier.
I thought the droning part was a nice
Anyway,
change in.
it's a beautiful.
Well, hell,
song,
we can't finish on this one. Let's do one.
Okay,
Hell no,
okay.
goddamn, that can't be the last song of the year.
Well, you want to sing "Old Lang Syne"?
I guess we could. Let me see if I can find it.
You can find it. It's right there. And the same thing. There it is. Music traditional. The pro version. Here's the chords. Should
Music traditional. We're going to. You doing an F?
I'll do it in whatever key you want.
Did all acquaintance? We forgot. Yeah.
What key you want to do it in?
Yeah, like F. Let's do Did all acquaintance be forgot?
What is that?
G.
That's what.
Never thought to mind. Ooh, no. Too high.
All right.
Let's try
E.
A.
A.
All acquaintance be forgot. Never come to mind.
No.
Yeah.
C.
Let's try C.
Should all acquaintance be forgotten and never brought to mind?
Should all acquaintance be forgotten and things
Okay, let's get that right.
Yeah, E, A. Skip the D minor 7.
Okay.
And days of old things I think just 3. Let's go E. Days of old things So let's go E, D.
No, it's not
D. D7.
No, that's not on mine. I've got E, A minor, F, G, C.
Ugh. Let's do E.
Are you doing the traditional version, the pro version?
No, not the pro version.
Okay, hang on. Yeah, we go to the pro version then. It's
Mm-hmm.
old acquaintance be forgot and old lang. Okay, here we go. A, G, C.
A, G, C. Yeah, that sounds better. Transpose to a
Old
C.
acquaintance be forgot and brought brought to mind.
There you
go. Should all
acquaintance be forgot and old lang syne. All acquaintance be forgot and never brought to mind. Should all acquaintance be forgot and old lang syne. Old lang syne, for old lang syne will take a cup of kindness yet for old lang syne. And you'll surely be your fence suit, and surely I'll be mine. We'll take a cup of kindness yet for old lang syne. For old lang syne, my Joe, for old lang syne. We'll take a cup of kindness yet for old lang syne. What are these words? we twy round about the braes and pound the guanies fine. We'd wonder mony where you fit old lang. Where'd you find us? For old lang syne, my Joe, for old lang syne. We'll take a cup of kindness yet for old lang syne. Oh, I don't even know what to say. Old lang syne, my Joe, for old lang syne. We'll take a cup of kindness yet for old lang syne. I don't know what. That is, I don't know where the hell you found that version. That's let's got some words.
Okay, try it. True in the Auld Lang Syne, right? So it's A minor, F, G, C.
Yeah, that's what I was playing.
Okay.
Yeah.
Okay.
Let's
Just leaving
see.
out the E.
Sean, those lyrics are in Welsh or something. Yes, they are. They're in something I'm unfamiliar with. Dr. Steve's got the version that was popular when he was a kid back in 1692.
Find me.
All right. We
Let's see.
Yeah, but it should be E. Yep. E.
Yeah, you're right. Your version is better. It goes, and all days of Auld Lang Syne. So it's D minor. E,
Yeah.
A minor, D minor, G7, C.
Yeah.
Let's try that version.
I would say just do the E, because you transpose it up to C, correct?
Yeah, you could do, and days of Auld Lang Syne. You could skip the G7.
I would say just go E and Old Lang Syne. Just go E, G, C. And old, and I'll just play the E.
But it's and days of Auld Lang Syne, though, so the days has got to be a minor.
I don't know where you're seeing it. Tell me, so I'm on
Should
the...
old acquaintance be forgot and days of Auld Lang Syne.
Well, hang on now, that's a different song I got.
Those
Now,
are the words.
I just you told me to go to the pro version, which I did.
I know, well, now I'm saying I'm going to your version.
Oh, for fuck's sakes. You didn't tell me that, you doofus head.
Yeah, I said let's go to the other version and see, and then this one's got the D minor 7 instead.
Oh, so you want to play the E minor. And days of old anxiety. So you want to go E, A minor, right? D minor 7, and skip the G7, go right to C.
Yeah, that's what I'm
okay,
saying. That's what I'm
okay,
saying.
okay,
Yeah.
okay. Now I know where you are, for fuck's sakes.
Okay, well, keep up.
I was still in the goddamn the traditional version. All right, here we go. All right, so Well, how about that? Should old acquaintance be forgot and never come to mind? Should old acquaintance be forgot and old anxiety? Old anxiety, my dear, for old anxiety will take a cup of kindness yet and days of acquaintance be forgot and never brought to mind. Should old acquaintance be forgot and days of old anxiety? For old anxiety, my dear, for old anxiety will take a cup of kindness yet for old anxiety. It's just the way we could do that if it was just we did one beat
and just keep
E.
singing all lang syne at the end.
Yeah. Okay. All right. Last time, guys, we're out of here.
Okay.
I know we're killing everybody. Soft. Hey, I hope you enjoyed the Alabama crushing Kent State. That's hard to believe. And everybody, what's the Tennessee game last night? Yes, they should be in the national championship game. We all know that. That's common sense.
I was at this New Year's Eve party in the mountains of North Carolina, and they'd hired a band that didn't know this song.
Oh no!
And they just kept going, "For old lang syne, for old lang syne, for old lang syne, for old lang syne." It was hilarious.
That is
I
funny.
was laughing my ass off. And what I was going to do is just keep cranking the reverb up till it was just I don't know what. All right, you ready?
Yep. Hang on, let me get back to my right page. Ladies and gentlemen, this will wrap it up. Colin, make sure you send us another email. Old Aunt Zion, that is pretty close.
Old Aunt Zion.
You guys take care. Have a good one, and Old Aunt Zion. There you go.
Sing it.
Oh.
Let's do the song.
Should all acquaintance be forgot and never brought to mind? Should old acquaintance be forgot and days of old anxiety? For old anxiety, my dear, for old anxiety will take a cup of kindness for old anxiety.
Keep
We'll take a cup of kindness yet and days of old lang syne.